on their phone. Now, this question is, which of these 4 drugs cause nutrient depletion? Does Geodon cause nutrient depletion? Does metformin? Does Strattera? Or does propranolol? Okay, I love it. Got lots of options. So Pharmacist's letter came out with a chart, like hundreds of lines long, of all the possible ways that drugs can deplete different nutrients. It has everything from cancer drugs down to oral drugs that we commonly dispense in a community pharmacy. I limited it to only the clinically relevant ones for oral drugs. So first of all, we're going to talk about fluoroquinolone and tetracycline antibiotics. As we know, they bind up several nutrients, especially those ions, the iron, magnesium, and zinc, and calcium. And so on our chart, you can see the name of the drug, the nutrients that are depleted, and if you don't know what they are, at the bottom, that's the name of each nutrient, and how it works. Finally, whether or not we actually need to supplement that, whether that drug needs the vitamins or the other nutrient that's being depleted, whether we need to give it as a supplement to replace what's been lost. So for the tetracycline and fluoroquinolone antibiotics, it all depends on the timing of the dose. We don't necessarily need to supplement that. We just need to carefully explain to our patients to take them separately. Then we have methotrexate. And methotrexate is a folate antagonist, so it causes folic acid depletion. Now, we should supplement this for patients who are taking it for a non-cancer thing. So the rheumatologist will often prescribe the folic acid 1 milligram to go along with it, or whatever dose. And that makes sense, but we don't want to recommend this to somebody who is taking methotrexate for cancer because it might interfere with the efficacy of the methotrexate. Then we have metformin. Now, metformin, as our previous speaker said, is like Tylenol. It's the best drug for diabetes, but it does have some nutrient depletion. It can affect the folic acid and vitamin B12 and B1. And so should it be supplemented? Well, it probably should be. Their primary care physician, or if you have a great collaborative practice agreement, you could order labs. They need to be following to make sure that they have enough B12. And if they don't, it should be supplemented. Then we have digoxin, and the renal excretion of magnesium is a problem. So should we supplement it? Yes, if we're following those labs again. The statins. Now this one's controversial. Should we supplement coenzyme Q10 when somebody's taking a statin? The evidence goes both ways. Does it help with statin myopathy? Maybe. Does it really deplete coenzyme Q10? Maybe. The evidence is conflicting. So if you have a patient who's struggling to be adherent to their statin because of myopathy, then it couldn't hurt to suggest the coenzyme Q10 supplementation. And the great benefit of all of this is your pennies prescription of prednisone or metformin or the statins. You're only making a few pennies on it. Now you can add in these other alternatives to make more money on your transaction, right? So then loop and thiazide diuretics, they both cause the body to excrete lots of urine, including lots of electrolytes. So often potassium-sparing diuretics are given in conjunction to prevent a lot of that depletion, but other electrolytes are being depleted. They can be supplemented. Then we have our immunosuppressants, cyclosporin and tacrolimus, and they affect magnesium through the renal reabsorption. At the bottom here, we're talking about the anti-seizure drugs, the old ones, the anticonvulsants. These are carbamazepine, phenytoin, phenobarbital, and valproic acid. As we all know, they have lots of drug interactions. And not only just drug interactions, they have lots of vitamin interactions. Because of the way they're affecting the cytochrome P450 enzymes in the liver, it can interfere with how the vitamins are broken down or whether they're even absorbed. So there should definitely be supplementation for patients who are on these drugs. On this chart, we start with the PPIs. We've kind of already talked about PPIs, that they decrease the acidity of the stomach. And so drugs, vitamins that are absorbed when there's a low acid environment are poorly absorbed. So they can be supplemented. And then the iron is because people who are on PPIs often also have a GI bleed. And so if they have a GI bleed, obviously they're becoming anemic and should have iron supplementation. Then we have our corticosteroids. We've already talked pretty in depth about our prednisone, and we'll skip to the estrogens and oral contraceptive pills. I learned in pharmacy school all about why we need to take prenatals for childbearing women who are trying to get pregnant. What I didn't realize is that if a woman's childbearing, she's either pregnant or breastfeeding, she is being depleted by her baby. But if she's taking oral contraceptive pill, those almost the same nutrients are being depleted. So unless she's either not sexually active or not using any form of birth control for another reason, every situation during the childbearing years indicate using a prenatal vitamin. So you can suggest that to all women in that age range. Then sulfasalazine. It depletes folic acid because it blocks the absorption, and so when they're on a high dose of that, then they should be supplemented. NSAIDs can cause a GI bleed, and only in that case would you supplement. Otherwise, they don't need supplementation. Then we have orlistat, which is Xenical or Ally, the weight loss drug. It works by blocking fat absorption. And so it also blocks the absorption of fat-soluble vitamins. Those need to be supplemented. Then isoniazid and rifampin, those are not as frequently dispensed, but they do deplete nutrients. And what's interesting is that if isoniazid is given with rifampin, then it prevents those nutrients depleted by rifampin from being depleted. So they are synergistic when they're given together. So now that you've got more information, what is the answer to this question? A, B, C, or D? Metformin. Yes, that is our answer. Metformin. And that is such a frequently prescribed drug. You can suggest supplementation and make a few more dollars on your prescription.